So in previous lecture, we saw urolithiasis, most common site and most common calculi. In which species these are the common? As I explained, the most common site, uh, from this diagram, this was the rectum. Here, rectum, this was urinary bladder. Urolithiasis means urolith may be formed at any part of the urinary tract. Suppose this is a part of your ruminant. This is the sigmoid flexor, and this is os penis, and this is the tip of the penis, and this is the urethral process. So I explained to you that in case of bovine, it is distal to sigmoid flexor at this point. Distal to the sigmoid. If this is sigmoid flexor S-shaped, then distal to this flexor. In case of dog, distal to os penis. In case of ram, sheep and goat, it is the base of the urethral process. Like this. In case of horse, this is the urinary bladder. So from this we saw all the species. So today we'll see what happens in case of ruminants. As I explained in case of dog, the approach was first you do retrograde hydropropulsion. The meaning of this terminology was that this was the bladder and this was the os penis, urethra, and what we were doing with the help of normal saline, the calculi was here, and we were sending this back to the bladder. This is the meaning of retrograde. After this, the second step in case of dog was cystotomy. Means you make one incision here and bring the calculi out. This was in case of dog. Now we'll see in case of ruminant. In case of ruminant. Ruminant will divide into two parts. Small ruminant and in case of large ruminant. Small ruminant will see what happens in case of goat, sheep, buffalo calf, and cattle calf. Large will see the bullock. That is male bull. Male. So first we'll see small ruminant, sheep, goat, buffalo calf, and cattle calf. In case of small ruminant, if we see goat and sheep male, if we see these two, in both the cases, the first most common site of urinary calculi is the base of the urethral process, UP. That is the urethral process base here, because it is the narrowest part. This is very no chances because it is thin. Here it can get accumulated. The base of urethral process. This is first most common. Second most common is, number 2 is distal to sigmoid flexor. Second common is this one, and first common is this one. So in case of sheep and goat, if we go for, this is the most common site. So if we start the surgical correction, then we start from here, from the most common site. So what we do, urethral process amputation. Amputation. Here, if suppose these calculi, they are not present here, if they are present at this point, then your approach will be called as post-scrotal urethrotomy. So, first we'll see what is urethral process amputation. This is the most common site, so we'll start our surgical correction from the most common site. So, urethral process amputation. This urethral process, this is the tip of your ram penis, and from this tip there is very thin process come out, and the stone may be like this. So this is the calculi stone or calculi, and these calculi are mainly phosphate calculi. These are the phosphate calculi. So this is the urethral process, and we are talking about amputation, means we are cutting this urethral process like this. So to cut the urethral process, what is important? Anesthesia. So remember, lumbosacral site 2% lignocaine is used. So lumbosacral epidural. This anesthesia is used, and we cut this urethral process. So most common site is removed. So calculi is removed. The urine will pass immediately from this part. So if you remove this urethral process, then urine will come out. Urine will come out. But the complications of this urethral process, the first complication is because the calculi are sand-like multiple in number. So what is the significance of multiple in number? Multiple in number means one calculi present here, one is here, one is here, one is here, one, one, one. Suppose you remove the calculi of this one, urethral process. This calculi is present here, and this is. The chances of recurrence are more. This is the most common complication if you remove the urethral process. So, recurrence chances are more. Means multiple calculi which are present higher in this path, they will come and they will block. So this is not a permanent relief. It will give the animal a kind of temporary relief. Temporary relief, and recurrence chances are higher. So this is not a permanent method to give relief to the animal. After 2-3 days or 4-5 days, the animal will come again with the same problem, that the animal is not urinating. Urethra is obstructed. So recurrence chances are more because of this temporary relief. So what is the best method? What is the best? Tube cystotomy. This is the best method. This is the best method. In IVRI, daily we are getting 5 minimum and 10 maximum, sometimes 14 more than maximum. Cases where we are doing tube cystotomy, where we are doing tube cystotomy, minimum 5 and maximum every 3-4 days, sometimes come 10 cases or maybe 14 cases per day. This the complaint the owner comes here. Two type of cases are coming every day. Male goat, male goat, and male. These cases are we are doing daily. Their history is in both the cases. History is same. Anuria. Animal is not urinating. Some owners say for 2 days, some say for 3 days, some say for 4 days. History is same. In case of in this area, what they are feeding, that is in local language, that is called choker. This choker is nothing but wheat bran. Wheat bran that is rich in phosphorus. Rich in phosphorus. So this phosphorus may lead to phosphate calculi in male goat and male buffalo calf. So daily here, what we are getting is the history of not urinating. My animal is not urinating for 1 day, 2 day, 3 day, 4 days. And if we ask them what they fed, the answer will be choker, that is wheat bran, which is rich in phosphate. And second, second predisposing factor is water intake. Before this, it was January month. These are the winter month. In case of winter, water intake is less. So if and taking rich phosphorus rich diet, phosphate calculi. After taking it, we start our surgical process. What is the surgical procedure? Tube cystotomy is nothing a kind of bypass surgery. What is the cystotomy is? This is the bladder sigma urethral process. Urinary path. This is the normal keeping one and like this tube is catheter, Foley catheter. In case of buffalo calf, here we are using 16 gauge and what we 14 gauge. If it varies, so this is the male goat we are using. Foley catheter is not, you can kind of tube cystotomy. So this is the tube. Cystotomy means this is tummy means uh, opening here. You can say stab in the tube inside the bladder. We inflate. We, we fill not here 20 ml water. After inflating this, it will not, it will remain inside the bladder. This is the purpose of inflation of the catheter. So this is the meaning of tube system. With the help of cause of calculi. So we have the route of the urine. Now urine will come out from this path, this new path created by us, come out from this path. What will happen to this path? We are giving medicine ammonium chloride. The urine. Normally, the urine of ruminant is ruminant and phosphate. Calculi opposite precipitate makes for smaller stones. But what we are doing, giving ammonia the urine. If the urine become acidic, calculi is acidic, same it will dissolve. So ammonium chloride and
आवाज जा है बीच में।
in case of buffer, these are calculi and we have entered Foley catheter. The ammonium chloride, this will the urine is also acidic. Calculi both are same, will dissolve. It will. So this is the main basic behind the surgery. In the 21 to 20, we are keeping the tube inside the body, are dissolving these calculi with tablet. And we dissolve all the calculi and it's the path clear. Urine will come out from the normal oil. Once urine will come out from the normal, what we do after 22 or 24 days, we remove the tube. We remove the tube because now urine is coming from the normal path. So this is the tube cystotomy. After, if I summarize, so first we were taking history of the patient was in is not coming. This is the history for 2 days. Second is our cystotomy. And tube cystotomy, I will explain. Then the final step is removal tube after comes coming from natural fish is natural doing lumbosacral 2% ligno के 2 animal is kept on the right recumbency. Then in the incision we paramedia to the midline and cranial to vestigial teeth because it is a male animal. So the last teeth will do that. This is the incision. So after giving incision, we enter into the abdominal cavity. Enter into abdominal cavity. Entering, we find bladder. After finding the bladder, we put then inflate the part of the bladder. This job Foley catheter is kept inside. Okay. Then we suture the abdominal cavity and muscles and close it. Urine will start through Foley catheter and post-operatively we give neum for 1 to 28 days at the rate of 250 milligram per kit. This is the process. So this is tube in case of are coming here bypass side. But in case of ulolectomy, then is different. Site is ischiorectal fossa. Ischio other fossa. This fossa is anus. This is the anus. Then here, this is the site where you enter and keep your tube, your Foley catheter. Remember this ischiorectal fossa. Other things are same in the male goat and then okay, and all other are same, giving ammonium. Now, breathotomy. First, I and in case of bullock. This and the bullock sigmoid flexure. Distal to sigmoid flexor. Calculi is there. This is the and which calculi is more common in case of ruminant? Struoid, which are eating feedlot, because in case of pasture grazing, it is most common is your say. So this is calculi here. Two reason, two reason. Why we go post scrotal tummy in case of is the S-shaped sigmoid flexure. This is the reason is this is urethra. In this region, behind the scrotum is just beneath the skin. Incision, you will find urethra. In this is so scrotally your urethra side difficult as compared to scrotally urethra is just beneath to make it urethra calculi and remove the calculi. So post urethrotomy is only done. The reason is just skin urethra will be calculi. The second reason is sigmoid flexure and the scrotum, and this is the most common urethra. So the second is and at distal to sigmoid if the calculi is here, then post approach will go urethrotomy. Second, because if first most common site is distal to the sigmoid flexure, if it is not, then upper approach is called ischial urethra. So this was about urethrotomy in the bullock. Some clinical sign in ruminant. What are the clinical signs? First, I told you urea means the animal urinate. This some difficulties. Hematuria is RBC in urine. Suspension of and vision. But if urinary bladder is ruptured, the condition is belly. Condition is called water belly is bilateral, means both sides, bilateral distance abdomen. If urethra rupture, then the condition will be when edema will accumulate in the ventral. So these are, it is called when clinical goat tail flag tail flag able to urinate. So it is the tail flagging. So hysterectomy, it MCQ come in case of bullock or bull, it is post scrotal. It is post scrotal. If they ask in case of boar, it is pre. If they ask urethrostomy site, commonly prefer is scrotal. It is left. Ha. RAM also, because second most common is post scrotal. So these are the preferred sites. You can approach through any side, but these are the most common sites. So some important first one is common, most common in true or false. Second is most common. The Asian dog is this is these are the three. So calculi in Dalmatian, it is false because most common calculi in true white. This statement is true. Most common are white. Common calculi in is true white, but urate are most common in what in case of Dalmatian. Uric acid normally convert into allantoin, that is soluble product. This uric acid converted in case of Dalmatian. Uric acid excreted via the in the urine. It is excreted, not converted 100%. Why it is not converted into allantoin? So reason for this is uric acid is not convert only 30 to 40% is converted and remaining 60% will go out via in the urine. So why it is not converted? reasons. Reason number one, because reduced transport, because of reduced this urate by liver is unable to transport this uric acid, so it is not converted into allantoin. The second reason is deficient enzyme. The enzyme which contains allantoin, it is deficient in the Dalmatian dog. The two reasons. If someone asks only calculi having its treatment, answer is urate, and the drug will be allopurinol. The action of this drug is to inhibit xanthine oxidase. So this is the only calculi which is having treatment as allopurinol, and regulate the or make the alkaline, make the pH opposite and dissolve the calculi. So that's what about the urolithiasis.